Hi, good day and good afternoon. Welcome to our presentation, Considerations on Monkeypox in Our Community. I'm going to start with a quick introduction as to who I am for those who are watching. So I am Dr. David Folks, MD. I'm a 2014 graduate of the University of Medical Sciences in Santiago de Cuba. I was previously a general practitioner of medicine with an emphasis on HIV management, and I'm currently the Community Health Outreach Manager at Thrive SS, providing health literacy to the communities. So when we talk about monkeypox, the most frequent concerns I've heard so far are: where did it come from? Is this a gay disease? Why is it spreading in our community? And what does this mean for people who are living with HIV? And how exactly safe and effective are vaccines? So in order to start answering these questions, we have to go through what monkeypox is. So monkeypox is a viral disease. It's from the same family as smallpox. It can cause general symptoms. Those include fever, weakness, muscle aches, sometimes rash. It can cause a rash that is characterized by skin that's fluid filled, and these lesions can be all over the skin, and it's associated with intense itching. There is no cure for monkeypox. However, most persons fully recover from the disease. If the infection becomes complicated, monkeypox can be fatal. So looking at the history of monkeypox, answering the question, where did it come from? Monkeypox was first identified in 1958 among monkeys in Copenhagen, Denmark, which is why it was denominated monkeypox. It was first identified in humans in 1970 in the Democratic Republic of Congo, which was previously known as the country of Zaire. Several animals act as natural reservoirs for the virus, which include monkeys, Gambian pouched rats, as well as dormice and African squirrels. Now, there have been previous outbreaks of monkeypox, generally confined to the continent of Africa. However, previously there was a 2003 outbreak in the US, which was caused by a bite from a prairie dog, which was purchased at a swap meet in the Midwest. Now, the important thing to understand is that monkeypox is a disease that, even though it is prevalent in humans right now, it can also be in animals which act as reservoirs for the virus. So in this case, that prairie dog was infected potentially by Gambian pouched rats, which were imported on the exotic animal trade, and that's how it ended up coming to the US in 2003. So here we have a slide that shows the spread of monkeypox currently in the 2022 outbreak. All the areas that are signaled in red are countries which have reported cases of monkeypox in 2022. Now, looking at the local data, considering that we're in the state of Georgia in the US, as of the 14th of July, we were up to 86 cases, and all the cases that were reported were among men who have sex with men. Also, of these people, there were 36 black persons reported, 11 who were white, 3 who were Asian, and 36 who have not reported our race. In terms of ethnicity, there were 3 Hispanic, 64 non-Hispanic, and 19 who are unknown. In terms of HIV status, 37 persons were not living with HIV, and 39 were living with HIV. 10 were unknown. Of those living with HIV, 37 of 39 were African American, and it's reported that the majority of those persons are virally suppressed. Fulton County has 48 of the 89 cases that were reported. Well, 86 cases. I'm sorry, that's a typo. But when we look at Fulton County, particularly based on the data that was obtained from the 18th of July, there have been 56 reported cases. And when we look at the race distribution, we see where 55% of those persons were black, 5% were Hispanic, 4% were Asian, 23% were white, and 12% had no race reported. In terms of HIV status, 30 were not living with HIV, and 26 were indeed living with HIV. So what we can tell from this data is that this is a disease that is currently disproportionately affecting people who are men who have sex with men, and it's also disproportionately affecting Black persons. When we look at the signs and symptoms of monkeypox, the signs and symptoms may commence anywhere from 5 to 21 days from exposure. This is what we call the incubation period, right? Now, those early symptoms can include fever, headache, muscle pains, maybe a little bit of fatigue, as well as swollen lymph nodes. So you may feel swellings in your neck, swellings in the groin, swelling under the arms, right? Then after that, the skin lesions begin to appear. They begin distally at first. That's to say, it may start on the palms of hands or on the hands or on the feet, and then it gradually moves towards the center of the body, right? Many cases in the 2022 monkeypox outbreak have been noted to present with genital and perianal lesions. This is of very important clinical interest. So these are images showing what the rash from monkeypox looks like. We see here where the rashes can be very, very intense, or they can have a very light distribution. What's also important to note when we're talking about signs and symptoms and we're looking at the images that are displayed with monkeypox, a lot of the images that are shown on the internet are going to be represented by Black persons. But it is important to know that this is not a Black disease. This is not a disease that is restricted to the Black community. This is something that also appears in persons who are white. It's also currently an issue in the media because there have been racial tensions which have arose from the use of images showing Black persons only with monkeypox. So it's very important to note this when we're talking about monkeypox with the community. So this is a closer look at the skin lesions which present in monkeypox. Here we see where the skin lesions begin simple, looking like a regular bump. They become fluid filled, and then after a while they become umbilicated. That's to say that the top of the bump sinks in, kind of like a navel, which is why we say umbilicated, which is what we're seeing in image 3. After that, the images begin to crust. They become ulcerated and begin to crust over, and then those scabs fall off. Once a new layer of skin has grown, then you know that you have passed the transmissible phase of monkeypox, which we're going to talk about shortly. So the skin lesions, as I said, they eventually become crusted and turn into scabs that eventually fall off to facilitate a new layer of skin growth. Now, these symptoms can last from 2 to 4 weeks, and the symptoms may be atypical or severe in persons who are living with HIV, particularly those who are not virally suppressed. So when we look at transmission, it's important to know that monkeypox can be transferred through bites or scratches from animals that are infected with the virus. Also of note, if meat is consumed from animals which are infected with monkeypox, that may also be a way of contracting the virus. It may be transferred by direct contact with the skin lesions, but it may also be transferred by indirect contact with contaminated objects and surfaces. So we're talking about linens that may come in contact with the skin of someone who is infected with monkeypox. Or even surfaces that have come in contact with that skin. It can also be transferred through close contact and through respiratory droplets, because as we speak, we know that sometimes these respiratory droplets escape the mouth and they can be transferred from person to person. So you find that the virus may travel along those respiratory droplets. It can also be transferred through intimate contact, such as kissing, cuddling, or sex. So during the sexual intercourse, it's important to note that even though monkeypox has not been proven to be found in vaginal or seminal fluid, the simple act of sex, which involves a lot of kissing, it involves a lot of touching, hugging, that very close contact is really where the transmission occurs, as opposed to the act of ejaculation. So there is no ejaculation required to transfer monkeypox. That's very important. So transmission is only possible if someone has symptoms of monkeypox. These can be the early general symptoms, including the fever, the malaise, the weakness, the muscle aches, but a person may remain contagious until the new layer of skin has grown over the lesions, right? So that's very important to note when it comes to quarantining and ensuring that you're not passing monkeypox from person to person. You have to ensure that that new layer of skin has grown. It's very similar to chickenpox in that way. So that's very important to note. So when we talk about who can get monkeypox, absolutely anyone can get monkeypox. This is absolutely important. We looked at the epidemiology before, and we see where of the 86 cases that were reported, all were men who had sex with men. But it's very important to note that this is not a disease that is strictly contained within the LGBTQ community. This is a disease that can jump from anyone to any other person. So, of course, that begs the question, why is it then that it seems to be restricted in the LGBTQIA plus community? So one of the things that we have to be aware of is that as people who identify as gay or bisexual, we tend to have social habits that do facilitate transmission. These social habits may involve hugging, kissing. We're not afraid to come in contact with each other, as opposed to our heterosexual counterparts who may not necessarily display that level of physical contact, right? So that is one of the reasons why I believe that monkeypox has been traveling so rapidly within the gay community. And of course, birds of a feather flock together. We tend to socialize with each other. We tend to come in contact with each other on a more regular basis than we would with persons who are heterosexual. And so that may facilitate the transmission of monkeypox within the community. So when we look at the complications of monkeypox, right? Some of the more frequent complications may include pneumonia, right? The virus may infect the lungs and cause serious pneumonias. It may cause sepsis, this is where the virus gets disseminated in the blood. It may cause encephalitis. This is where the virus attacks the brain and there's inflammation around the brain. And of course, in the event that the eyes are affected, those lesions can become complicated and can lead to loss of vision. In the case of women who are pregnant in particular, monkeypox has been known to be responsible for stillbirth or birth defects. So that's very important to note. So when we look at treatment, monkeypox can be treated in a number of ways. The main treatment is usually reserved for persons who are children, persons who are pregnant, or persons who are living with HIV who may not be virally suppressed, or persons who may find themselves in an immunocompromised state due to medications that they may be taking or any other condition that may cause immunocompromise. So the main antivirals that are used are TPOXX and Tembexa. And when we go forward, we look at the outcomes and we see where monkeypox is rarely fatal. It has a mortality rate that's usually between 1 and 10%. But the current monkeypox outbreak of 2022 is caused by the West African variant that is known to have a very low mortality rate. And so that mortality rate is about 1%. Complications such as pneumonia, sepsis, and encephalitis may lead to death. So these complications are, of course, more frequent. When we look at, for example, persons who are living with HIV who are not virally suppressed, these persons are more likely to experience some of these complications. So it's very important that we emphasize and stress viral suppression within our community. We see where there are a number of people who are living with HIV who have contracted monkeypox, and so these considerations are very important, and we cannot stress enough the importance of viral suppression. In terms of prevention, monkeypox can be prevented using behavioral changes such as washing your hands frequently, ensuring that you wear a mask in crowded and indoor spaces, and avoiding contact with those who are infected. However, vaccination is the recommended way to prevent the transmission and spread of monkeypox. Smallpox vaccines have been known to show 85% effectivity in preventing the monkeypox infection, and also is effective in lessening the severity of the disease. Now, these smallpox vaccines, they're not new. These smallpox vaccines were successful in eliminating smallpox before. It's the only disease that's been successfully eliminated amongst humans, and these are the vaccines that were responsible for that. So these vaccines were stored in case of biological warfare or in case of emergency. And of course, because of the cross coverage with monkeypox, we find that these vaccines come in handy when it comes to managing the spread and the treatment of monkeypox. So there are two vaccines which are available, the ACAM 2000 and the Jynneos vaccine. The vaccines may be given pre-exposure, that is before someone comes in contact with the monkeypox virus, or after exposure. Now, in the case of post-exposure, the monkeypox vaccine is recommended anywhere between 4 and up to 15 days after exposure. In the case of 0 to 4 days, it may prevent monkeypox infection. However, in the case of 0 to 15 days, with that particular window, it's more likely that it will reduce the symptoms of a monkeypox infection and prevent the spread of monkeypox. So vaccines are currently in low supply. However, several 100,000 doses of the vaccine are currently on the way to the US. So it will be widely available for everyone pretty soon. So going into a little bit more detail about the vaccines, there are two vaccines, as I mentioned. The ACAM 2000 is a second generation live replicating vaccine. This is to say that what is being introduced to the body is a live virus that has the capacity to multiply within the body, right? The aim of this vaccine is to cause a small localized infection on the skin so the body can learn what the virus is like, so it may build an immune response. It generally builds a very strong immune response because of that localized infection, but it also makes the person more susceptible to side effects of the vaccine. So things like fever, nausea, headache, muscle pains, chill, and infection site reactions such as redness and induration are more likely. Also, this vaccine uses a bifurcated needle and it requires several pricks into the site where it's injected. So there is the possibility of scarring that's associated with this particular vaccine. It is not recommended for people with weakened immune systems, children, or persons who are pregnant. Why? Because this is a live vaccine, and of course, there's a need for a sufficient immune response in order to control the virus that is introduced in the body because of its capacity to replicate. So this is why it's not recommended in these groups. Also, persons who may have skin conditions such as eczema may develop a condition called eczema vaccinatum, where we see very disseminated lesions across the skin looking very similar to monkeypox. And we definitely do not want anyone to get sick from such a vaccine. So it's very important to be very open and be very honest when you're filling out that vaccine form, when you're ticking which illnesses you may suffer from. It's very important to understand that that medical history is important to share at that moment in time. So the Jynneos vaccine is a third generation vaccine. This vaccine is live, but it is also attenuated. It is non-replicating. So the virus is introduced into the body, but it does not have the capacity to replicate, right? The vaccine is given in 2 doses, which are 4 weeks apart, and they have very few side effects. It's injected into the back of the arm, and the side effects are very similar to the previously mentioned ACAM 2000. However, the symptoms are mild, the side effects are mild, and they're much fewer. Also, it's very important to note that even though this is a non-replicating vaccine, in a person who may be immunocompromised or a person who may be living with HIV, for example, and is not virally suppressed, they may not build that same response with the immune system to acquire that immunity from the vaccine. So the vaccine may not be effective. So understanding that viral suppression is important is one of the biggest messages that we have to get forward to the community at this time. So when we look back at the concerns about monkeypox, these were the 5 that we previously mentioned. So we're going to look at the summary to see if we are now equipped to understand how to respond to some of these concerns. So we see here that monkeypox is not a new disease. It's endemic to the Democratic Republic of Congo with occasional outbreaks to other regions. Monkeypox is not exclusively associated with persons who identify as gay or bisexual. However, it has been prevalent in the 2022 monkeypox outbreak. This may be likely attributed to our social behaviors. Viral suppression is essential for persons who are living with HIV for effective prevention and to avoid complications. Vaccination is about 85% effective in preventing monkeypox and is also effective in reducing symptoms and preventing the complications. But most importantly, vaccination is safe. The vaccine that is most widely distributed right now is the Jynneos vaccine. This is the vaccine that they're ensuring that everyone gets because of the lower rate of side effects and because it is generally safer than the ACAM 2000. All right. So, do we have any questions at this time?
Absolutely.
Sure.
So, the social behaviors part, I'm confused at that because initially when the monkeypox originally was out, it wasn't strict to, or it wasn't affecting Black MSM the way it is now.
Mm-hmm.
However, when it's coming back, we shared a lot of those similar social behaviors with other cultures as well. So why is it so starkly affecting Black MSM?
So, to answer that question, I would say that, okay, so for the persons who are viewing, the question that was asked was, why is it that monkeypox is currently affecting Black MSM persons now if it hasn't previously affected Black MSM in the same way during the previous outbreaks, and why is it so restricted to that community? Am I correct?
Yes.
Okay. So to answer that question, it all depends on contact, on who is that first person that contracts the virus. Now, remember, in the previous 2003 outbreak, this was an outbreak that was caused by persons who were purchasing animals from a particular dealer, and those animals may have bitten or scratched persons, and they contracted monkeypox in that way. In this case, the illness jumped from country to country from persons who were traveling, right? Now, in this case, this is a case where human-to-human transmission was more prevalent than in the previous 2003 U.S. outbreak. So we are more likely to see where our social behaviors tend to influence more the way that it's spreading, as opposed to previous cases where it was where a lot of the cases were from animal to human. I don't know if that helps to answer the question a little bit.
Sort of.
Okay. We can go further to say that for example, I know when I see my friends, when I socialize, when I go out, there's a lot of hugging. There are persons who are not afraid to greet each other by kissing on the mouth. There are persons who are, they speak, they whisper to each other. There's a lot of very close contact. Those respiratory droplets may pass directly in that way. But also, we do have to remember that while it is not sexually transmitted, the act of sex can facilitate the transmission, right? So that also factors in when we look at the spread among the LGBTQIA plus community. Because again, even though it's not found in vaginal or seminal fluids, we can see where that close contact, the kissing, the cuddling, the skin to skin contact, that definitely influences the way that it transfers from person to person. So that is not to say that it there's no risk of transfer during sex, but because of that close intimate contact and the likelihood of persons who belong to that community associating with each other, that's what facilitates the spread within the community. I don't know if that assists. Okay. All right. We have two more questions. I will take Kennedy's question. Yes.
What is the recommendation for people who will not reach viral suppression?
Okay. So the question is, what is the recommendation for people who will not reach viral suppression? That is actually an excellent question, especially because you are speaking to a community which may not necessarily represent the majority of persons who are living with HIV. That's a very difficult question to answer at this point. It's even though someone may not reach viral suppression, it also doesn't necessarily translate to immunocompromise. You can have someone who may not be virally suppressed, but their immune system or their T cell count may be strong enough to fend off infection, to fend off the virus. In cases of persons who do not have that response, it may be a concern for those persons. So that's definitely something that we do need to talk about a little bit more, because ultimately that is a worry for that subset of the community. Yes, Malcolm.
So you mentioned respiratory droplets.
Yes.
So we're still dealing with COVID, right? So when they did the studies on COVID, they said it does spread by, respiratory droplets, but you need to be with somebody for like 15 minutes in an enclosed space. Do we have the same restrictions for monkeypox?
Okay, so to answer your question, for those who are viewing, Malcolm is asking basically what are the restrictions when it comes to being in enclosed spaces with persons who may be infected with monkeypox, considering that there's transmission from person to person with respiratory droplets. You know that there are, you didn't want to necessarily be in enclosed spaces for more than 15 minutes with those persons, correct? That was the question.
With COVID.
Right, with COVID. Right. Okay, so the rate of monkeypox transmission may not necessarily translate to the same rate of transmission as COVID, right? COVID as a exclusively respiratory disease may transmit a little bit faster and easier than monkeypox through respiratory droplets. It also depends on what concentration of the virus is in the respiratory droplets. That determines how likely it is to pass from one person to another through that route. Now, that being said, this is a unique case of monkeypox in the sense that we've never seen monkeypox this disseminated. And even though we know these things about monkeypox now, I have not found information to necessarily say, hey, don't stay in enclosed spaces for more than X amount of time with a person who may be infected with monkeypox. So that's actually a very good question. But at this point in time, what's recommended, though, is that use of PPE, especially in persons who may be healthcare workers who are working with persons who are currently infected with monkeypox. PPE is absolutely essential. But at this point in time, especially because monkeypox is not transmissible when there are no symptoms, if we're in a room with no one who has symptoms with monkeypox, it's very unlikely that one would contract monkeypox from a situation like that, right? During the incubation phase, it's not like COVID where you can, be going through life totally asymptomatic and be passing on COVID to a number of persons. In this case, no symptoms, no transmission. At least that's the data that was presented from the CDC.
Is there a length of time? You said about the sheets or clothing. Is there a length of time that, so if the person had monkeypox and I laid on the bed, and I don't directly lay on it, maybe the next day, is there still a chance I get monkeypox? Should we be taking those sheets off?
Okay. So that's a very good question. DC is asking, what is the time period that the monkeypox virus may stay alive in linens, etc.? I currently haven't found any data to support that yet, so that I wouldn't necessarily say that I have fixed information. But if you know that someone has contracted monkeypox and has been in contact with particular surfaces, it's best to ensure that those surfaces are clean, ensure that those linens are washed, right? So that we're not facilitating that transmission. Again, it's very important to stress that monkeypox is not transmissible if a person isn't symptomatic. So it's not like, okay, someone lays down in a bed and they don't have monkeypox, they don't have any symptoms of monkeypox, it's like you're gonna get paranoid. It's definitely not a case of that. But if you do know someone who has contracted monkeypox, who has come in contact with certain surfaces, you want to ensure that those surfaces stay clean. But in terms of time that the virus stays alive in those on those surfaces, on linens, I currently don't have that data. I'm not sure if that data is actually out there as yet. As I said, the cases of monkeypox have not been such that it's been seen on this global level before. We've never seen this wide an outbreak. And only in 2005 did monkeypox ever jump outside of Africa. That was the very first case outside of Africa. So the information that's out there about monkeypox is not necessarily as deep. It's not easy to find. Persons who are specialists may have that information right now, but for it to be widely available, a little bit more research needs to be done. Yes, Malcolm.
So given the path of transmission that we just spoke of, even though it is heavily impacting the men who sleep with men, would we expect, if we don't get a handle on this soon, would we expect that this would spread more into the general population?
Absolutely. The more persons that contract monkeypox, the more likely it is to spread. So, of course, the general population is definitely at risk of contracting it. It's not necessarily restricted to our community at this time. Currently, that's the case in Georgia. But in other states, we're seeing where it's in many different communities. But it definitely can and will spread if we don't get a handle on it soon. The number of cases are rising exponentially. The more cases and the more infections, it's the more likely that we're going to see a spread and an explosion of it. You remember that this is how COVID started. It started as 1 case, then 5, then 15, and so on and so forth. And so we saw this gradual, very sharp rise of the numbers of COVID. So at this point in time, I mean, while you don't want to cause mass public alarm, it's also something that we do need to raise alarm bells about, and we do need to raise awareness, because if we're not taking the measures to ensure that monkeypox isn't spread, which at this point is vaccination being the best measure, it's going to be very difficult to get a handle on it.
Thank you.
TJ, did you have a question?
Yes, I have a question. So if they do share similarities with exposure and the way that they're spread, and monkeypox actually shares more modes of transmission than COVID did, why are the numbers more so leaning toward minority populations than COVID did?
That's an excellent question. So TJ is asking, why is it that numbers are leading to more towards minority populations, considering that there are more ways for monkeypox to be spread. Am I correct? Okay, so the numbers tend to lean towards those minority populations because of two main reasons, in my opinion. One, because of lack of access to resources, lack of access to healthcare education, lack of systems that are set in place to ensure that persons are prepared to face this. So I think that's very important to highlight. Minority populations generally don't share the same levels of healthcare access or healthcare education as persons who are not in minority populations. So this lack of education and this lack of awareness sometimes can lead to the facilitation of the spread in those communities. Because if you're aware that something is happening, right, you're more likely to take measures against it. I'm not sure if that helps to answer your question, but you seem to have a little bit of a clarification. Do you want to clarify it a little bit more?
I was just about to say I get that, and I thought that too. My
Mm-hmm.
concern was that I don't have they stopped vaccinating for smallpox and monkeypox. They did stop at some point because we
Um,
mandated it.
So the smallpox and monkeypox vaccines are actually still available. I got my vaccination just last week Saturday. The issue is that the vaccines are not very widely available.
No. I'm saying like before this new outbreak happened.
Oh, before this new
Nobody was
outbreak?
getting
Right.
vaccinated.
So the thing is, no one was getting vaccinated against smallpox with the smallpox vaccine because smallpox is the only disease in human history that has been eliminated, like successfully eliminated. Smallpox doesn't exist anymore amongst humans. And so because of that, there was no need to continue with smallpox vaccination routinely. Now, in the case of monkeypox, even though there is cross coverage with monkeypox, we've never seen an outbreak of monkeypox this big. The first outbreak of monkeypox that happened in Africa, it was about 339 cases and there were about 33 deaths. This was the Congo Basin variant, which has a higher mortality rate. At that point, it was like, whoa, we're seeing this thing, but it was like restricted to one particular region. And then, of course, after that, we saw yet another outbreak. This was with the West African variant. This was like 500 and something persons who were infected with monkeypox, and the majority recovered successfully. But there was that 1% mortality rate from that case. So because it's been mostly restricted, because these outbreaks happen and they happen in very small pockets of time, it wouldn't be routine for somebody to vaccinate and to necessarily take those precautions against something that wouldn't necessarily affect a broad spectrum of the population. Because even when you think about healthcare from a preventive perspective and not necessarily risk, cost benefit analysis, right? The cost to vaccinate everyone against monkeypox or against smallpox or against a disease that's only affecting 1,000 people worldwide, or only affecting like less than 500 people worldwide at any given time that there's an outbreak, it would necessarily be routine because of that. But no, there is this huge awareness because we're at a point where this is basically another pandemic. So that's probably why.
We had a comment from Facebook. Can you reiterate what are the symptoms that we have to look out for?
Okay, so going back to the slide with the symptoms that we do need to look out for, I'm gonna see if I can jump back to that slide really quickly. So here we have the slide with signs and symptoms. Excuse me. Again, these can start like anywhere from 5 to 21 days after exposure. The symptoms include fever, headache, muscle pains, and fatigue. They may be accompanied by swollen lymph nodes, so you might feel swellings under the chin, behind the ear, under the arms, in the groin area, right? And then, of course, the skin lesions begin to appear You might see bumps on the hands, on the feet. They start generally from the outer sections of the body and then they move closer to the central points of the body. So that's what we call that centrifugal distribution, where we see a greater concentration of the lesions on the distal parts of the body. And of course, again, a lot of the cases in the 2022 monkeypox outbreak did have genital and perianal lesions. So that is also something that we need to look out for. And here it is again, some of the images of what the skin lesions may look like. These skin lesions, particularly the ones here, I'm not sure if you can see the pointer on the screen, but like these ones are lesions that are currently umbilicated. Like these are well-established lesions. These are not necessarily early lesions, but if we look over to this slide, we can see the 6 stages of lesions. So this is what the lesions look like initially. They form vesicles that generally tend to swell, become fluid-filled, umbilicate, right? And then further in the fourth image, we see where there's an ulcer. It becomes ulcerated. It crusts over, and the scab falls off to facilitate that new growth of skin. Is that? Oh, there are more questions. Yes, Chris. Uh-huh.
Can you pass the virus without presenting bumps, or do you have to have the lesions first?
So I would say yes, you can pass that virus without presenting the bumps, because if you generally have those first symptoms, the prodromic symptoms like the fever, the headache, the nausea, the muscle aches. Remember that monkeypox is also contained in body fluids, and that includes saliva and your respiratory droplets. So at that point, you can still be passing monkeypox even though you're not necessarily presenting with the skin lesions yet. So that's very important. Did someone else have another question just now? Yes, Tony.
So, looking at these pictures, this kind of looks like something as if I was like a shaving hair bump. So, how would I know the difference to differ between like a regular ingrown hair bump that I would get versus me having monkeypox?
Okay, so in the case of an ingrown hair bump, that's a more firm, more solid type of bump. Whereas in the monkeypox lesion, this is something that it's like what we would refer to in Jamaica as a water bump. It becomes fluid filled, right? So you will notice that first, and then it's very unlikely that the lesions would come up just as one solitary isolated lesion. It might come up as one initially, but by the next morning you're going to see multiple multiple lesions, generally starting again on hands and feet and moving closer towards the center of the body.
Okay. Well, 3 things.
So we have another question. Yes.
I don't know. Is this broadcast
Yes.
to people outside of Thrive Network?
Yes.
Oh yeah, I'm gonna ask that.
Do these itch? Because I had mosquito bite over the weekend and I was praying.
Okay, so Reggie has asked the question: do these lesions itch? Yes, these lesions are accompanied by intense itching. Comparatively, you could compare it to having the chicken pox, except that this is way more severe. This is something that lasts a longer time frame. It's an entirely different virus, but the symptoms look very similar. Chickenpox, however, doesn't necessarily come with the disseminated swollen lymph nodes, so you're not going to see like lymph nodes in your groin region, necessarily below the jaw, under the arm. That's not necessarily the frequent thing in chickenpox. It can happen, but it's not the most frequent thing, whereas in monkeypox, that's something that's prevalent. Are there any more questions?
So I have someone who actually did have, or does, I guess currently have monkeypox.
Okay.
He's part of our community. He went live last night. He was in the hospital, and he was showing his bumps, and he didn't have those dramatic bumps that are being shown in the media. His looked nothing like that.
Okay.
And also, someone who is on our network also reached out to me on Facebook and wanted to spread awareness about having monkeypox as well. Also, did not share that same dramatic bumps all over. So when we're looking for these symptoms, they're not presenting like chickenpox to where they're. I have yet to see anybody actually who, from this new outbreak, have them spread out like that. They've
Okay.
been very small. His looked like hair bumps, like you said, looked like ingrown hairs. He had one that was on his forehead that had went through those stages already, and it was literally this little. One was in his like scalp, one was here, but that was one of the few. So even interacting with people, how would we know?
That's actually a very good question. Whilst monkeypox itself is not new, it's now jumped to a new region, a new community, a new set of people. So, of course, the way that it may present may not necessarily be the most typical. And then, of course, environmental factors play into that too. So you are right. It may not necessarily present exactly the same as some of these images that we're seeing, particularly those in the media with these great disseminated lesions that are huge, but they are there. And so the characteristics of the bumps, the things that you do need to look for is that, again, they tend to be very fluid filled and they have like a thin membrane at the top, right? So
What would happen?
what was that?
If you pop them, what would happen?
So popping them is not recommended because that can actually increase the scarring that is left by the lesions after it goes away. But if you were to pop it, depending on the stage, the fluid that might be in there may be yellow or clear, depending on the stage that it's in.
And then will it refill or will it just
It
expedite this process?
it will it can refill, but it may generally expedite the process to become ulcerated, crust over, and then the scabs will fall off. So it all depends. The thing is with medicine, it is not an exact science. Not everybody will present in the exact same way, right? So these questions that you are asking are very good, because it does make people a little bit more vigilant, a little bit more aware. So thank you for contributing that as well, because knowing that there are persons in our community who are not presenting with the typical look that we're seeing in the media of monkeypox, that's actually very vital information.
Also, I did have another question from what he said. So he is experiencing pain in his rectum, and he said that he has this ongoing feeling like he's trying to do a crunch all day, like his lower abdomen pain constantly. Like his
Okay.
stomach's always tight. But when he tries to go to the bathroom, it's excruciating pain beyond like measure. Like he literally was crying every single time he has to go to the bathroom. So is that from sexual contact? Like, do you receive the lesions and bumps in places where you were contacted? Or just anybody who gets it are going to receive those bumps in their anus or anywhere?
So as I said, like the data is showing that some of these lesions are appearing on genitals and the anus. Oh, just for those who are watching, the bit that TJ just added was that he knows someone who is presenting with excruciating pain, with bowel movements, abdominal pain, someone who currently has monkeypox. So his question was, is it that some of these things are necessarily associated with sexual play, or is there a factor where the point of contact is usually the first to display signs and symptoms? Yes, that's a possibility, that the main point of contact is where a lot of the lesions may appear. But again, it's not exact. It doesn't necessarily have to happen like that. And also, in the case of the abdominal pain and the pain during the bowel movements, I wouldn't necessarily be able to say if that is related to the monkeypox or maybe there's a concomitant issue going on. That would be something that would require a lot more examination, a lot more deep digging, because that would not necessarily be a typical presentation of monkeypox. But what we can definitely say is that these lesions appearing around perianal lesion and on the genitals are things that we do need to look out for. And again, to your point, because it is a new population, being able to understand the differences and understand the changes is something that we do need to get the word out in the community to see if there is anything new about how monkeypox is behaving in our population. Cody, yes.
Another question from Facebook. How can we tell if it's different from a cold or flu? And how long does it take to start to see lesions appear?
Wow, that's a good question. Usually it's actually very difficult in the early stages. A lot of viral illnesses tend to present very, very similarly. And of course, the common cold is a viral illness. So that general prodromic phase with muscle aches, fever, that weakness, that the headaches that we may experience, it might be very different than, it might be very similar, I should say, to monkeypox. But I think the defining points are, for example, in the case of the flu, it's a respiratory virus. So it's likely that you're going to be presenting with other respiratory symptoms, including your runny nose, your cough. I can only speak from my experience and what I've seen in others and what I've seen in previous patients. Generally, by the time the fever starts, there would have already been that sensation within the nostrils, or maybe a cough to say, hey, like, I definitely think I'm coming down with the flu. You're getting that tickling sensation in the nose. You're starting to have the runny nose and stuff. But in monkeypox, of course, it can be very quiet during that prodromic phase. And how long does it take to see those skin lesions? It generally varies, but it's generally not very long after the beginning of the fever and the malaise and the weakness. So it can vary. All right. Is there anyone else? Any other questions?
So just
Seeing
to,
how they're handling this very similar to the way they handled the AIDS epidemic, do you feel as though because they won't start doing major work until it starts affecting larger or white populations, and so we're going to have to do things for ourselves? Or do you think that because there's already vaccines available that they're going to try to make it available to the black and some population first?
Okay, so that's a very good question. TJ is asking if this will mirror what the beginning of the AIDS epidemic looks like, where there wasn't a lot of movement, there wasn't a lot of awareness, there wasn't a lot of prevention going on until it spread it to white communities. That was the question, correct? Well, I can tell you that what is being done now currently. There is a very, very big effort going on to ensure that communities of color are vaccinated, because we're seeing from the data where communities of color are disproportionately affected. When you see that the majority of cases are black persons and we only consist of 13% of the US population, that is extremely alarming. I think one of the things that our healthcare system is now aware of, especially with the advent of the pandemic, is what has happened in the past, or medical distrust. And they're also aware of the fact that there are very serious disparities in the access to healthcare and the concern for our community. So I think the authorities are learning. I know that they're actively making efforts to ensure that communities of color are targeted when it comes to vaccinations, and making them readily available, widely available, making them free of cost. and ensuring that they're reaching out to sites where they know that persons are going to need that level of care. So huge shout out to a lot of the departments that are doing this work. We know that Positive Impact in Duluth has been having vaccine pop-ups, as well as Fulton County Department of Health. They have been doing a lot of work in ensuring that persons get vaccinated, but particularly communities of color who are being affected by this current epidemic.
Yeah, and I'll just add to that. Since the first few cases, since we started seeing the first two cases in Atlanta and throughout Georgia, we've been getting communication. Shout out to Leisha McKinley Beach, who posted, who made a social media post and pretty much said, we are not doing this again. We are not going to allow, black men who sleep with men, black people in general to be the last on the list, because there was a vaccine event, a vaccination event that it reached a whole lot of white guys, and the advocates in the community just came to life. And so what's different about today than in 1980, we didn't have that many. I mean, we were dealing with the civil rights issues, but we didn't have that many gay activists, right? Well, now we're here, and shout out to David, shout out to Joshua at Fulton County. We've been getting communication like immediately. If you know, David went on social media last week and we posted a video. So the minute we get the information, we're passing it on, because we're not going there. I lived through that, and I'm not allowing that to happen. So I know that most of the advocates my age and younger, we're just not allowing it to happen. There have been some mistakes. There have been some mess ups, but we have been calling them out as they happen. So as soon as we get the information on when this next vaccine delivery happens, you guys will be the first to know. And because of the work that we do, I recommend that when this next one comes out, that you guys go get it. Because y'all know how we do. We hug. Y'all come in this building, y'all gonna get a hug, and so we just want to make sure that everybody is being safe and everybody has the resources and the access that they need. And we will continue to work that out.
Thank you so much for that, Malcolm. And Kenny, thank you so much for bringing this information to the desk. One of the things that Kenny just brought to us was the information about transmission when it comes to the R number. So when we talk about R number, we're talking about the number of persons that will be infected from another person. And so we looked at a comparison of what the R number looked like for COVID versus monkeypox. Now, when in the case of monkeypox, the R number so far is less than 1, right? And this does stand to reason because monkeypox does require a lot of close contact to be transferred from one person to another, whereas COVID, this is something that is traveling through these respiratory particles through the air. And so with COVID, especially being a more aggressive virus, we were looking at an R number of 8 to 12. So the spread of monkeypox is not going to necessarily be as rapid as COVID. It may follow a similar pattern, but it may not necessarily be as rapid. So thank you so much for that information, Kenny. That really helps. Are there any other questions? Are there any questions from the community? We welcome any questions that you may have, and we will try to answer them as best as possible.
Yeah, great job, David.
Okay. All right. So we're going to wrap up the stream. It's now 2:30. Thank you so much for joining us. Oh, we have one more question.
Is there a test for monkeypox?
Is there a test for monkeypox? So Yes, currently, they can test for monkeypox, but it's not a test that's necessarily widely available. It's not an at-home test, so they are doing blood testing to confirm that these are indeed cases of monkeypox, so they're not confusing it with something else. So yes, there is testing for monkeypox. It's just not necessarily widely available or given to the public at this point in time. But that's a very good question, and I'm not sure if that will necessarily be the case. The hope is that we can control this epidemic before it gets to that point, but that's definitely a very good question. But we do have to wrap up the stream. It's now 2:30. Thank you so much for joining us for this stream. We really do appreciate you coming out and asking your questions. The video will be available on all platforms after this is done, so you can feel free to ask your questions in the comments. Or you can reach out to us at Thrive SS on any of the platforms that are listed above on the screen. We also have a QR code, so if there are any persons who need linkage services, who need connection to care, who need more information, you may use the QR code that's displayed on the screen to go to our linkage page to get access to services. Thank you so much for joining, and enjoy your afternoon.